In a world obsessed with the perfect form, there are those with choices.
More natural look.
I need some Botox.
And those who are born without one.
We need to expand, release everything.
Give her brain space to grow, right?
All the cuts will be along the cleft, nothing on the outside.
With over 20 years of experience in cleft and craniofacial surgery, Vincent Yeow is a renowned plastic surgeon in Singapore.
Once I have harvested that, then I will open the nose.
Plastic surgery in general, part of it is treating the mind.
Specializing in both medical and aesthetic cases, how does Vincent balance function with form?
What do we do? What do we add? What not to do? What is important? If you don't believe you are beautiful, no matter what you do, you will never be beautiful. What we do is, once we're done, right, with everything else, when I move to the chin, I will untick and shift to the side.
So we just dip first.
Yeah. Tip.
First surgery of the day. Plastic surgeon Vincent Yeow is ready to transform someone's face. A routine he has been loyal to for the past 20-odd years.
This is the only life I've known. I don't know any other. I never worked as anything else. So this to me is normal. Anything else would be strange.
Vincent has a chin to make even smaller and pointier. First, he has to replace the patient's existing implant before he can reshape her chin.
Right. Okay.
What?
My guess is correct.
What?
The implant is a bit off. We see everything. We see people who have had deformities. People with no problems, who want to look different, who want to look younger.
Part and parcel of plastic surgery is making people look better. Patients come in and say, okay, I want to do this surgery and I expect it to be 100% perfect. So that is the most difficult issue that I have to face, expectations.
So this is a problem area plus concal.
So one side of the one nostril is asymmetrical, right? One side larger. How about nasal bone?
Fellow medical director Dr. Paul shares Vincent's background in craniofacial surgery. He left KK Women's and Children's Hospital 2 years ago to join Vincent's private practice. Now, they are devising a surgical plan for a patient with a facial cleft.
Pain next time.
As reconstructive surgeons, both are realistic in their approach, even for aesthetic patients.
Because the human body is designed a certain way, that part also got to look like what it should look like. For patients who don't understand that, how do you ensure that they don't go beyond the boundaries?
This is a fine line beyond which some have crossed unknowingly.
My life, in fact, now is a bit of a emptiness syndrome. I've been a housewife for about 26 years already, and I gave up my career for my children. What I love about being a housewife is that 你可以自然醒，自然醒. Yeah, but the disadvantage is that sometimes it gets boring. And the fact that you actually don't have an income, you don't earn your own income, you don't feel that confident.
As a former promoter for beauty products, Lily had grown to become quite particular about her looks over the years. One feature especially stood out for her.
This acquaintance actually told me that my fifth feature is nice, except that my nose is too flat. And then there was this Han Fong also, right, about nose and all that. So she said she can recommend someone who can do a very good job for me.
In 2013, Lily got herself a steal for a rhinoplasty or nose job at 5 times less than what a professional plastic surgeon would charge. Delighted at the thought of fixing her biggest eyesore, she did not question why the surgery would be done in her own home.
To be very honest, I think I'm very naive, I'm very trusting, and I think I'm very stupid. 我老板啊，有些太软了。I didn't think that there was anything wrong about my nose until 3 months later, when I discovered that when I moved, it was like shaking here. 一块的会比较软呢。
2 months ago, we had this lady come in who had her nose job done. The implant was in the wrong position, so she wanted us to correct it.
The doctor was telling me, you are actually very, very lucky. But he did warn me that there will be some complication. So for him to operate will be much more difficult.
I just did some fat grafting this morning. Nothing big, just a small operation. If the schedule is quiet, then we're lucky.
Vincent now has to attend to a lineup of clinic consultations, among which he is expecting a familiar face.
Morning.
Morning.
How are you?
Okay, I want to do the thighs, everything about the thighs, the buttocks, stomachs, and this time I want to do arms.
We did do the thighs and the buttocks last time.
Yes, and the stomach too.
You want more?
Yes, I want more.
What if there's no more?
I'm sure there is. I'm getting fat.
Okay. You try and understand what went through their mind. So you have to temper their expectations and explain what you can and cannot deliver. Here to here, so that's...
I'm very excited. I want to go in and do this and come out being happier.
In 2016, close to 24 million aesthetic procedures were performed worldwide, with a 9% increase from the year before. With more people resorting to plastic surgery as a quick beauty fix, how has it shaped our views on body image?
In the present day, having the right look, the right features, it does matter. It shouldn't, but it does. And it's because of this there is this boom in aesthetic surgery. How far they're willing to go, it really depends on how they see themselves in relation to their professional and social life.
This is Gracia, one of Vincent's repeat patients. This is the second time she is seeing him for a full-body liposuction.
I enjoy dressing up and I keep wanting to make myself look better every day. Knowing that I'm going to do the lipo this time around, I've bought 18 new dresses in preparation for post-lipo body. So I'm really looking forward to that.
2 years ago, Vincent successfully extracted 4.9 litres of fat, giving Gracia the dream figure she could not attain, even with an exercise regime and dieting.
If there is something that I do not like about myself, it would be my body. It's something that I struggled with my whole life from young. My friends called me a lot of names. They used to take a passport photo of mine where they found and they chased me around the classroom with my passport photo, and I cried badly. It's just teasing, it's like fun to them, but I don't think they ever thought that it would really affect a person that much. Where's Mommy's shoes?
Yeah.
Here. I wear?
I
I wear?
will.
Yes. Thank you. So being a mom is very different from what I thought it would be initially. When you have your own children, they can make something that's really, really simple mean so much. That means nothing to anyone else, but to them it means the world.
Despite the joys of being a mother, the effect of childbirth on the body was too much for Gracia to bear.
I just kept gaining weight, so it was just very, very bad. Hence the decision to do the second round. I was also going to fix something that I wasn't happy with before, which was my breast.
This is the third time Lily's nose has had to endure a major surgery. She is a victim of a botched nose job by an unqualified beautician. Unhappy with the result, she underwent a second surgery and even had fillers injected, resulting in a slanted nose.
When patients come in and they've had an unhappy result, you have to feel for them sometimes. You try and understand what went through their mind, where was it they're unhappy with, you know, what could have gone wrong.
Oh, 所以你说能够拿到这个壁图吗？这不是你的。壁图是这个来。是
This look like you. This part you Photoshop. When they come in and say, "Oh, I want to look like this. I want to achieve this kind of thing," they don't realize that the image itself is doctored. Previous operations, not so straightforward.
I want it slimmer and sharper. He was doing this. No, but he's okay. He's alright. He don't judge me. So I did discuss with him, and he understand what I want. Okay. Okay, 你做主 I trust you. 你做主了哈。
When we see patient having a botched job, it saddens us. She basically knows what she wants. She just met the wrong people.
See your teeth, honey. Yours.
Of course, more or less, I'm scared lah. But I would say that in some ways, I would say that I'm left with no choice also. 第三次了，是会紧张，多少都是会啦。I prayed. I have to pray very hard.
Any drug allergies?
No, not that. Where's Dr. Vincent? Oh, you must do a very nice job for me, huh? Good job, huh? Thank you, ah.
放松，手放松。1、2、3。
Before Vincent can reshape Lily's nose, he needs to rectify the mistakes from her previous botched surgeries.
We had to dissolve the fillers. We don't know what was put in. See, that's the problem.
This being Lily's third rhinoplasty, Vincent must avoid aggravating the existing scar tissue. With the old implant and fillers removed, Vincent now has room to correct the projection of Lily's nose tip using a new implant.
Many people will say, why are you putting yourself through that? But everybody views things differently. Sometimes superficial, inconsequential things, to some people, are like extremely important, especially in a society such as today.
It has been 5 years since Vincent stepped down as head of the Department of Plastic, Reconstructive and Aesthetic Surgery at KKH.
Most people didn't think I would stay in public practice. They thought I'd be first out the door. But I didn't, I stayed. It got to the point that I realized we needed new thinking, new blood. So I stepped down. Here is different. Now in private practice, I don't have a responsibility to anybody other than my patients.
In 2016, fellow medical director Dr. Paul also made the switch to join Vincent's practice. Having worked together for almost 2 decades, both are close like family.
I have to donate. My son also cutting hair.
Is it? He's cutting hair, is it? Okay, which one?
Small one.
Small one.
Big one will not touch his hair. He's 17 years old. You try and shave his hair.
When I was doing my plastic surgery training, a lot of the things that I saw in the theatre, I was able to assimilate very quickly. But then when it came to Vincent, right, technically he's different. There was still so much more to learn from him. This will be my
Dr. Paul is perhaps one of the most technically gifted plastic surgeons in Singapore.
So they are not going to reconstruct the nose, they just want to put a prosthesis for the nose.
In KK, he was supposed to be the next chapter. He cut his chapter short and he said, I want to go into private practice. You have a job for me? Of course, I'm happy to have him.
Returning patient Gracia is here for a fat graft to her breasts and a full-body liposuction. First, Vincent needs to locate the existing body fats that are safe to be extracted.
Dot is graft, line is removed. Everybody has different markings. All the surgeons only understand their own scribbling. Trade secret. All good?
Yes.
All right.
Let's go.
Nothing else, huh?
No. So I'm looking forward to be able to fit into the 18 new dresses.
To remove large volumes of fat without causing discomfort during the surgery, Gracia will be under general anesthesia.
Bye-bye.
I'm just going to make a little stab incision from where I will introduce the cannula.
Using a tube called a cannula, Vincent makes controlled motions to dislodge stubborn fats. But the remaining fat cells can expand if one does not keep up with dieting and exercise.
Most people think, oh, I'm going to lose weight by liposuction. It's not true. It's good for people who have that little bit extra, which you want to shape and, get the volume and the contour right. And that's what liposuction is for, really.
This common procedure is not without risk. One wrong move and the cannula might cause some serious internal damage.
You do so many until it's just a reflex. And you go towards where you think needs more, where needs less. You feather everything, try and get it even.
With the fats extracted from Gracia's body, Vincent has one last thing to do.
How much more you got?
I have another 60 here. You want to put on the same side or you want to put the other side?
Yeah, this way.
Don't mind me, I'm here, but you won't know. I'll stay right back and keep my profile low. You don't like that I'm different from the rest. sometimes different happens to be best.
Fat itself for augmentation of breast, what it does is your own tissue. There's no risk for infection because it's not a foreign body. A good way to use what we've harvested from her, rather than throw it away, use it as a fat graft and then revolumize, reshape, recontour her breast.
Wow, breast. And my arms. Looks very good. Everything has gone down already. I'm very happy with the results.
It has been a week since Vincent performed a corrective rhinoplasty to fix the failures from Lily's previous botched surgeries. But it seems like she is not completely satisfied yet.
My nose is actually, I feel that it's too big. What will you actually recommend?
I recommend
Whether I will stop getting plastic surgery, I can't decide, and I can't guarantee also. At different age, different stage of your life, perhaps you may change your mind again. I think every woman, basically, no matter how confident you are, there's always this measure of insecurity in you.
Now that I've done plastic surgery, I think 20 years later when I look back and ask myself if I have any regrets, I probably wouldn't. At the end of the day, I wanted to look in the mirror and be happy with myself.
I always sit here or sit like this. I don't know how that would be. No, because I like the sun. It's cold. You know, especially on a rainy day when it's very cold. This place, yeah, when the sun comes out, I'll sit here and I sort of like, I'm a bit like a lizard. Have to warm up. Every patient, every problem needs to be solved. Sometimes I will point out things that they don't want to hear. Regardless of what you do, regardless of what you aim for, it is important that you are happy with what you achieve, or what you are as a person, before you can really understand what beauty is.